We live in a deeply social world. From birth, there is an expectation that we need to exist in constant orbit around other people. So when someone steps entirely off that track, choosing to live a strictly solitary life, avoiding close friendships, and passing on romance altogether, people take notice. Society immediately rushes to diagnose this behavior. We assume severe social anxiety, that they are painfully shy, or on the autism spectrum. All of those labels are attempts to solve a problem that might not actually exist. They rely on the same flawed assumption, the belief that deep down, every single human being secretly craves social connection. Schizoid personality disorder directly breaks that rule. Because it contradicts the assumption that everyone seeks connection, it remains one of the most frequently misunderstood conditions in the mental health field. When we misunderstand why someone seeks extreme isolation, we run the risk of treating them for an illness they simply do not have. Clinically, schizoid personality disorder is a long-standing, stable pattern of behavior that remains consistent throughout an individual's life. In this social network, the individual drifts entirely out of the web, preferring extreme solitude. Internally, the schizoid experience remains cool and steady, showing emotional flatness and no romantic interest. Externally, they display unshakable indifference. Heavy praise or harsh criticism simply dissolves without reaction. Society tends to look at this list of traits and see a tragic deficit. To the individual actually living it, this structure operates as a perfectly self-sustaining emotional equilibrium. The most common mistake both peers and clinicians make is confusing this condition with social anxiety. The mechanical difference: a person with social anxiety deeply desires connection, but meets a violent block of intense fear, creating constant friction. With schizoid personality disorder, there is no fear blocking the way. The wish for closeness is quiet, leaving a dormant, inactive connection. An anxious person is trapped outside the room of human connection. A schizoid person simply has no desire to open the door. Recognizing that a patient completely lacks this social fear forces us to change our entire approach. We stop trying to cure a frightened patient and start trying to understand a detached one. We also have to separate this from autism spectrum disorder, which involves entirely different neurological and communicative criteria. It is also quite different from simple introversion. Introversion is about a social battery that drains quickly in crowds. Schizoid traits operate more like the absence of that social battery altogether. Once you eliminate fear, autism, and social fatigue from the equation, you are left with a unique, standalone state of fear-free detachment. Because these traits are not driven by fear or distress, the standard clinical approach has to adapt. Many people with schizoid traits are perfectly content living a solitary, low-key life. Plainly speaking, there is absolutely nothing wrong with that. We have to be careful not to pathologize a peaceful, independent temperament just because it makes a highly social culture uncomfortable. The goal of therapy is never to push an individual toward a lifestyle they genuinely have no desire to live. Therapy is really there for two specific scenarios. First, if the individual independently decides they want to explore richer connections, or second, if they are carrying the weight of secondary issues like depression or anxiety. Looking at this overview of accessible care, practices like coping and healing counseling are built on this exact model of respectful, non-coercive support. They maintain a diverse team of over 15 licensed clinicians, offering fully HIPAA-compliant telehealth services across all 159 counties in Georgia. Proper mental health support and getting an accurate diagnosis starts with a clinician accepting exactly who you are. To speak with a professional who gets it, you can visit chctherapy.com or call 404-832-0102.